let's just start by you telling us briefly how reattachment works when someone loses a limb or a digit.
We have a unique ability that's been developed over the last, say, 40 years or so with microsurgery techniques to reattach amputated parts of the body. This was first done in China and then gradually spread really over the rest of the world, and now is routine in almost any major plastic surgery center in the world. When we do this kind of work, we are often faced with difficult challenges related to damage to these structures, the microstructures, the arteries, the veins, the nerves. But it is possible in most circumstances to successfully replant an amputated part and give them back what they've lost in a way that cannot be done by reconstructing it with other means. So it's really something that really has been a revolution in reconstructive technology. As far as leeches go, the leeches that we utilize in the modern era are effective mostly because of a phenomenon we see with the blood vessels in an amputated part. It's usually technically easier to reconstruct the arteries than it is to reconstruct the veins. The reason being the arteries tend to have a higher pressure in them. They're coming more directly from the heart. The vessel wall is thicker. It's easier for us to suture that, even with the microscope. The blood then goes through the capillaries in the amputated part and comes back out into the veins. It's in a lower flow state. The vein also has been damaged and amputated. We can fix it technically. It's harder to fix. There's also a lower flow state in it, so it tends to close off more easily. And because of that, we end up with clotting in the vein sometimes, or a phenomena of the pressure in the vein just not being adequate to allow for the flow to continue, and that allows for a situation where there's blood getting in but not getting out adequately. And if that process isn't corrected, you end up having a complete death of the tissue with time because of back pressure and then eventually blocking off of the artery flow coming in as well. And what a leech does uniquely is apply a suction to the amputated part to remove that excess pressure of blood, but then also uniquely inject into the amputated tissues and those localized tissues around the amputated part unique vasodilators and anticoagulants, things that stop blood from clotting, that can be used locally to prevent clots from forming in those little vessels we're trying to keep alive. And that can really preserve the tissues. Usually what we're looking at in the most severe scenario is a situation where we've successfully replanted a digit, say a thumb, the most common one we replant, and we have a situation whereby we have to somehow correct for this venous engorgement, and the leech can replace the veins in a way for a long enough period of time for the body to actually grow new veins, which is a process that takes 3 to 5 days, part of the normal healing process. So if we're able to keep a digit alive for 3 to 5 days, we're able to really save the part completely. The scenario alternatively to using leeches is to systemically anticoagulate a patient and allow them to bleed from the amputated part by poking it with a pin and allowing blood to pour out, basically to prevent that pressure buildup. You usually don't have the same kind of localized positive effects of vasodilation and other things that the leech provides, and you may have to transfuse a patient if you have to keep them bleeding continuously for 3 to 5 days. And the leech replaces that process in a way that's infinitely superior to the other.
Okay, how did the...
Just wait for Karen to come up.
Okay, I thought you were still on.
Leeches were a very popular form of medical treatment, say 200 or 300 years ago. There's been stories of the leech population of swamps in France being depleted completely to service the needs of Paris physicians. And apparently they were used for pretty much everything. And like any treatment that's used for pretty much everything these days, there's a lot of quackery almost certainly involved. But I think that you can probably imagine scenarios where the leech could be quite effective also in ancient times for unique purposes. One example that has come to mind for myself is someone suffering from migraine headaches. Uniquely localized vasodilators, if applied to an area on the side of the head where vasoconstricted blood vessels are causing a migraine headache, you might actually be able to uniquely correct a migraine headache. You may also be able to improve conditions such as arthritis in the hands, or certainly any heart failure type of problem that involves venous engorgement, say in the limbs. That's where you may be looking at using hundreds of leeches to give you the equivalent effect of, say, diuretics that we would use in more modern times. You could see how those things could be effective. The use of those, the use of leeches really died out when new modern pharmaceuticals that would replace these kinds of things came about, and really the revival of leeches was only with the advent of microsurgery in this unique situation, and it's without question been a huge help in those circumstances where we really are in a tough position with blood vessel difficulties.
What's the typical patient's reaction when you tell them you're going to put a leech on?
Initially, horror.
You kind of make when I tell someone that we're going to use leeches, make a statement of it.
Okay. Well, when I tell someone that they are going to need to have a leech applied to their operative site, they're usually horrified initially and quite concerned. Almost always, though, within one or two applications, the leech becomes their very close friend, and they realize that this is really going to make a difference. It is quite an interesting phenomena. I've used leeches in children. I've used leeches in inside people's mouths in very complex reconstructions, situations that, of course, anyone would find potentially horrifying. But when you look at the alternative of the operation being a total failure and maybe loss of life and certainly loss of profound function, people usually accept that pretty readily.
Do you see leeches being used indefinitely, or will they eventually be replaced?
I think that they will almost certainly eventually be replaced. There is research going on now where some of these unique products of the leech saliva have been isolated and have been used in clinical trials, even in humans, I believe, in certain parts of the world, as anticoagulants, much more powerful anticoagulants than exist today, and also potentially applied more locally. So that certainly has been done. Other products within the leech secretion has also been isolated and utilized. The thing that the leech does with this unique sucking action locally, that hasn't been replaced yet, but I think it could be as well. So sure, I think that this will happen.
What do you think?
Okay, no, it's not.
Um,
There's a bit of noise out there.
That was the fan thing.
That's minor. That's
yeah. What would you like people to understand is the essence of using leeches in these kinds of situations, as, for example, in the case of treating a severed thumb?
Well, I think that it's important to have all aspects of your armamentarium available when you're trying to treat someone, and the leech is a last resort part of an armamentarium. It's certainly nice if you don't have to use a leech, if you're able to get the blood vessels together perfectly and they don't clot up, and you don't have these problems that necessitate their use. But if you need them, they uniquely can be effective. And I think that to not use them because of the fact that they're slimy and ugly and gross is a completely false logic. Nothing is more ugly and gross than having well, many things are ugly and gross, of course, but having a finger or a limb amputated, whether it's reattached or not, that's a very gross phenomena. if this has to be part of it, it's a small part. What you want is a recovery in the end. And if this can provide that uniquely, then more power to it. There's no question that there has been some, over time, difficulty with accepting this kind of process. Even big microsurgical centers, say 15 years ago, 20 years ago, would not accept this kind of technique. They would say, oh, this is contamination. Bacterial contamination could wreck the operative site and so on. And there's no question there is that risk. We're not talking about something that's risk-free, but still you can apply, you can achieve unique results. And it's something that should be part of the armamentarium at the extreme end of any microsurgeon.
What is the source for the leeches that you use here?
There are a few companies that are now, I guess, growing, harvesting these creatures. They're in the early stages of these companies. There was the same problem as there was 200 years ago of decimating the natural leech population of places where they exist. There are many different kinds of leeches. You can't just go to the local swamp and get a leech and expect that leech to do the job for you in this situation. The leech that is used most commonly is called Hirudo medicinalis, the medicinal leech, and it is uniquely found in its natural state in France, I believe, or in Europe. And it has a unique affinity for sucking on human beings, and many leeches, of course, will also do that, but this one can be more reliably attached, and it's the one that we use medically. Related to the hazards and so on, which I do explain to patients, the leech gut does have bacteria in it. The bacteria, in fact, is necessary for the leech to digest the blood that it has sucked out. It's a parasitic kind of organism that way, and the bacteria can infect the digit that is being treated. But one thing they say in plastic surgery, it's an old saying, beauty is a battle between, to say that again, plastic surgery is a battle between beauty and blood supply. And if the blood supply is adequate and is maintained at an adequate state, a minor bit of contamination from bacteria inside a leech gut is not a problem. As well, we know ahead of time what antibiotics can be effectively used to treat such an infection if it becomes necessary.
So just to come back to the thumb treatment that we're going to show, just kind of take me through that scenario as you did earlier about, you know, we do the operation, we come back 4 hours later, and then how you would check it and, if necessary, apply the leeches.
The most common scenario that we may have to use a leech treatment in would be a situation where an amputated part has been brought in with the patient, and we've taken the patient to the operating theater and we have reattached it using microsurgical techniques. We then pack the amputated part in dressings and carefully watch the patient. And if over the course of several hours there's evidence of venous engorgement, meaning impairment of the circulation of the digit so that blood's not getting out in particular very effectively, then we'll consider using a leech. We also may consider taking the patient back to the operating theater to redo a blood vessel, and we will do that if we think we can if we think that's the technical need. With an amputated part, though, we're often dealing with crushed and traumatized tissues, and we usually give it our best shot first time around, and there's usually not a lot of other options available. And in that situation, we'll bring out leeches and give them a try.
And then you might put on new leeches every few hours.
The situation is such that if indeed there is compromise of the venous outflow of the amputated part to a significant degree, we may need to replace that venous outflow for as long as it takes the body to develop new blood vessels, which is a process that takes 3 to 5 days typically. So we may need leeches as frequently as every 4 to 6 hours for that period of time. So the typical pharmacy that stocks leeches for these kinds of purposes has 20 or 30 leeches on hand. The companies that provide these leaches are in the U.S. or in the U.K. generally. It apparently is quite difficult to grow leaches, and these companies have a fairly sophisticated setup, but they're able to provide them usually with about 24 to 48 hours notice. That's not fast enough to save a digit. The typical situation in my experience is 1 o'clock in the morning on a Sunday, and in that situation you have to have them in your own pharmacy if you're going to be able to use them at all.
Anything else we haven't covered that you think we should mention?
I don't think so, other than perhaps to say that there's a sensationalism to the use of leaches that sometimes is the butt of jokes. This is a uniquely effective way of treating a unique surgical problem, and there is nothing better in this exact circumstance than the leech presently. And it's not something that should be poo-pooed, and it should be something that's utilized as a last resort, sure, but it's certainly something that should be utilized if it's necessary.
Great, good, thank you.
Just hold on for a second.
Wanna get
Sort
some
this
room-
out in the
room tone?
Just, would you be quiet for 20 seconds? Thank you. Okay. Thank you. 5 seconds.
And action. Light. Okay, do that again. Okay. Cut. And as the scene goes on, don't look around the room or anything.
be action? Liz, let's go have a look at Nick. Something like that.
Okay. All right. Roll. Wait for my cue. Okay. Action.
Liz, we better go have a look at Nick.
Light.
Nick,
Dr. Sproule's here.
how you feeling?
All right.
Everything went really well. We were able to get your thumb put back on, but I need to have a look at it right now, okay, to make sure that the blood vessels and everything are still okay. So I'm just going to take the dressing off. You bear with me, okay? You shouldn't feel any pain as I do this. Okay. What I want to do is just take the dressing down and have a look closely at the finger right now, okay? It looks like it's maybe a little swollen at the end. I usually have trouble getting the dressing off in the middle of the night because it's usually stuck. Nick, your finger looks a little bit blue and swollen, and I think that the veins may not be working as well as they should. We really can't take you back to the operating room to fix them, but I think we're going to have to try to do something else to save them, to save your thumb. And what I want to use is some leeches, okay? Now, I know that sounds gross, but what the leech can do is save your finger by sucking the extra blood off that's collecting here and giving your body time to make new blood vessels, okay? There's a small risk of an infection, but other than that, there's really no pain associated with this or anything else. Okay, so will you willing to let me try this?
Gotta do what you gotta do.
Okay. Liz, better go get some leeches. Okay, I'll try putting them on. If you stop rolling off a minute, I need to.
Yep.
His finger's not compromised enough. He's too
That's
healthy.
okay.
So I'm going to make it more compromised.
Just leave. And action and light.
Nick, how you doing?
All right.
Just going to have a look at your finger now, okay? The operation went well. We're able to put your finger back on and hook up its blood vessels.
Can you offer the doctor a bit more?
Nick, it looks to me like your finger is having a bit of problems with blood supply. I think that we're going to need to do something more to keep it alive. I can't take you back to the operating room and do any more microsurgery, but the veins in your finger are not working well enough. I think I'm going to need to use some other technique to keep the veins working. And one thing we use is leeches sometimes for this. What that means is taking leeches, placing them on the end of your finger, and then allowing them to suck a little bit of the extra blood out. That also causes things to happen inside the finger, which are very good things. Increases the blood flow inside the finger, and it can keep it alive. It can make the total difference between whether this lives or it doesn't live. There's a small risk of an infection with this, but that's really the only big significant risk. I think it's pretty much your only chance. So you're willing to let me try this?
You have to.
Okay.
Want to get a close up on that line? Sorry.
Yeah, okay, let's try it again. Are you willing to let me try this?
Right tight on. Yeah.
Are you willing to let me try this?
You have to.
Okay.
Could you do that one more time, please?
Are you willing to let me try this?
You have to.
You have enough level?
Yep.
Okay, good. Cut.
5.
Okay, speed. Action.
Nick, I want to have a look at your thumb, okay? Surgery went fine, but it's now a few hours since the surgery. We need to have a look and make sure things are okay. Okay, Nick, you shouldn't feel any pain with this, but I have to have a really close look. Can I have a look at your other thumb? Okay. Nick, the blood is getting into your thumb well, but it's not getting out of your thumb well enough. I think I'm going to have to use another technique which might frighten you a little bit to allow the blood to get out of your thumb properly. And that's using leeches. Leeches will suck the blood out of the end of your finger and also introduce some chemicals that will cause vasodilation of the blood vessels inside your finger, and I think will keep it alive. I think it may be the only chance to keep it alive. It looks to me like the veins are not going to hold up on their own. Will you let me try that?
Okay.
I'll get a hold of those now.
Cut.
And in fact, the typical scenario.
Okay, roll.
Okay, Nick, I have these little creatures here. I have to make a little tiny poke in the end of your finger to allow the blood to get out so the leech can latch on there. That'll hurt a tiny bit, but that should be the only thing that hurts. Actually, if you can cut that,
Yep.
it's not going to hurt at all.
Yeah.
Okay,
It's going
fine.
to hurt you. It's not going to hurt you in the real life scenario.
No.
So should I just start over again?
Yeah, we'll just start.
What the? Why again?
Oh,
From
do
how
it
about from
tighter
here?
this time, yeah. Action.
Nick, I've got our leeches out of the pharmacy. I have to poke a little hole in the end of your finger to allow a little blood to come out, so the leech has something to start sucking on. It won't hurt you at all because your finger's been chopped off, and so you can't feel it.
Okay, hang on a second.
Mhm.
Both of them. Your hand is covering. I don't know if you can do it without. Yeah.
Yeah, just bear in mind we're looking from this side. That's perfect. Okay, action.
Use too small a needle. See a little bit of blood coming out there now. Not a lot. We're in a tough situation.
See steady and wait for the leech shot.
I need to get better position.
Sometimes it takes a few minutes for them to attach.
Why don't you do that? Let me get in a better position. Think.
I'm happy with this. He's going on right now. Just trying to keep the focus there. Well, you want to be more frontal?
Well, okay.
Is the thumb clean enough, you think?
I think I just need to poke it again. Can you,
Cut.
if you go into...
The big getaway.